giving the task to convince you why you have to do neurosurgery. But I believe that everyone over here is here because they do want to do neurosurgery, correct? Am I correct? Yes. So I want to make this interactive, and I have just very few slides, which is just to motivate you, nothing more than that. But I also want to, chat a little about why I did neurosurgery, and also, if you have any questions or what are your motivations to do neurosurgery, and if there are any myths that I, along with the other faculty, can actually disperse in your mind about neurosurgery. Oh, I'm so sorry. We don't have time, and this computer is totally acting up. Okay. So why neurosurgery, right? This is what I think why neurosurgery, because it is brain surgery and not rocket science. Okay. Because I feel that it is more fantastic, more novel, more interesting, and more gratifying than rocket science. Okay, so that's just for me, right? But you may have your own motivation to do neurosurgery, right? So when neurosurgery comes to your mind, what do you guys think about? So I want to have some answers. When somebody says neurosurgery, what comes to your mind? Any answers? Hmm?
I don't know.
So one answer is that brain is the real state, right, of your body, and if something happens to it, you may actually change the outcome, right? Any other? Anything else? So she said brain. Anybody thinks about trauma when neurosurgery comes to the head? Adrenaline? Yeah. What else? Neurosurgery, yeah. Okay. Yeah. Anybody thinks about precision? Is precision a part that comes to your in your mind when you think about neurosurgery? Yeah, so it is. So whenever people talk, when I say I'm a neurosurgeon, every single person has said, "Oh my God, you have to deal with delicate nerves," right? So somehow, in general layman's head, the precision comes into mind that it has to be absolutely precise. And yes, as Dr. Azam had showed you, you have to be absolutely precise in certain cases. You have to make sure that you reach the right target and you don't mess up with all the important vital structures surrounding it, right? Yes, so precision comes to your mind. Life or death, does that come to your mind when you think about neurosurgery, right? So, as Azam said, that neurosurgery does attract a certain kind of personality, right? So, we know that we have to deal with life or death, right? We have to deal with a lot of responsibility that comes with it, right? When I was a medical student and I really wanted to do neurosurgery, it seemed very novel, it seemed very glamorous, and so that's why everybody wants to go into neurosurgery. But later on, when as you do neurosurgery, you really understand what it is all about. Okay, hydrocephalus was I put in mind. Does mind come? Does anybody think about mind when neurosurgery comes into play? Yeah, what do you think about mind? So we understand the brain a little bit, but we do not understand the mind. We understand the mind very little as scientists, right? Um, so who understands the mind, right? The yogis, the meditators, right? The spiritual ones, they understand the mind better, right? And as a scientist, we don't have much understanding of it, but we know that it's mind over matter every single time, right? There is a yogi who can sit in the Himalayas and will not feel pain, and he's not wearing any clothes, and he's sitting in the ice. How can he tolerate that, right? So this is always a mind over body, right? There are people who can actually fight cancers just because the sheer determination that they want to fight it, right? So I think that the mind part should come into your thought process when you think about neurosurgery. It should not always be about brain, right, or the anatomy, because we know very little anatomy. And mind, I think there are bigger parts of the brain that we do not understand at all. So in neurosurgery, you can take a whole bunch of brain in the right frontal area and we say nothing happens. I'm sure something happens. It's just we do not know anything about it right now, right? So mind should also come into play. Does this come into your mind when you think about nervous system? No. Somebody said this comes into mind when you think about neurosurgery. So how many people wants to do neurosurgery because of this show or this gentleman? Can you raise your hands, please? Nobody. I'm glad. I'm very glad. Do you guys know who this is? Right? This is, yeah, this is Derek Shepherd or McDreamy from the very famous Grey's Anatomy serial, right? And so, you know, a lot of people, when I tell them that I'm neurosurgeon, they would say, oh, you are like McDreamy, okay? So suddenly I am compared to this gentleman who's McDreamy. So I started thinking that, you know, a lot of people they know who neurosurgeons are. And if there are budding neurosurgeons, how many actually want to do neurosurgery because of this gentleman? So I'm glad that there are not a lot of people. So glamour doesn't play that much of a role into it, okay? Who wants to become neurosurgeon because this gentleman? Do you know who he is? This is Dr. Henry Marsh. He's a British neurosurgeon, and he has written a very famous book which is called "Do No Harm." Okay, and in this book, he has been very candid about all his complications that he had encountered as a neurosurgeon in his lifetime. Okay, and you know, we go into the conferences and people present fantastic cases, right? And they say, oh, I have done this, oh, I have done this. But there are very, very few people who would come up to the stage and say, no, I made this boo-boo. I made this complication. I had this complication. It takes a whole lot of courage to come and say that, okay? So here, I just want you to understand what neurosurgery is all about before deciding to become a neurosurgeon, okay? Neurosurgery definitely is attracted by a certain personality. And somebody says adrenaline rush. Yes, we are people who actually do love the adrenaline rush, right? And we do love the instant gratification, right? So we are that kind of people, and that's why we are attracted to these certain kind of personalities, right? So Dr. Douglas are sorry to say that, but in the US we used to say that orthopedics also attract a certain kind of personality, right? And right, so we can actually just determine by their body habitus that this is going to be an orthopedic surgeon, right? Or an ENT surgeon. Adam, I would say you look like more like an ENT surgeon, right, than a neurosurgeon. So so it is true, right? But neurosurgery comes with a lot of responsibility. That is one thing you have to keep in mind. Before reaching that, when you are starting to, for example, you go into a training program and you start doing it, you will make mistakes and you will make a lot of mistakes, right? Because that's how the learning curve is, right? And I remember when I started my residency program, I was told that here you cannot make mistakes because when you make mistakes, it takes people's lives, right? So you are handed that kind of responsibility when you start neurosurgery, right? So, you know, if you want to do something else, for example, you want to do orthopedics, you want to do ENT, you want to do general surgery. Some people think that neurosurgery requires a lot of working hours, but there are other fields that also require equal number of working hours, okay? The orthopedics is also intense, the ENT is also intense, the general surgery is also intense, you know? You do gynecology, it is intense, right? So the number of work hours, I don't think is something that categorizes neurosurgery, right? Because almost it's the same that you have to do. It's the same that you will not have a social life. You will, you will spend a lot of time in the hospital, and you have to do a number of years. But then they all have the same thing, right? They all have that. Whether it's any kind of residency program, it is usually long. It is usually requires a lot of hard work. You have to put a number of hours. You will not have a social life. And for women, sometimes it's difficult because they have to raise a family, they have to take care of their house. And a lot of women don't go into neurosurgery with this idea, and they are also discouraged with the idea, not just here in Pakistan, but I have seen people even in the US, the women are discouraged not to go into neurosurgery. And the idea is still the same, that you will not be able to take care of such a highly responsible job with taking care of your home, your children or not. But I guess I say that if you really set your mind to it, if you have the right spouse, I think this is the message I give to every woman, that your career success depends about the person you marry. Okay, so if you choose the right spouse, if he is the right person for you, and he's willing to give you the space and the time to do whatever you want to do, you can have a home life, you can have children, and you can do neurosurgery all together. Okay, so it is not impossible. Again, as I was trying to tell you, that in most of the programs, the hard work is there. The only thing that comes with neurosurgery is the responsibility. And it is the emotional responsibility that you take, because you are really dealing with life and death, and you're dealing it with every day. The trauma that comes into, the malignant tumor that comes into, the metastatic lesion that comes into you, there's a lot of emotional responsibility that you have to take, and then you have to understand that, and in time you learn how to deal with it. And I just want to let you know that whenever you, in time you will learn, but do remain humane about it. Do not lose your compassion, and do not lose your empathy. Even when you are used to of dealing with the patients, day in day out, sometimes what happens, that because to protect ourselves, we develop a hardcore, and then we also treat the patients like that. And believe me, the patients would know instantly that this person doesn't care, right? And it just comes through very easily. So please do make sure that whatever you do, neurosurgery or otherwise, you always have those components in them. I think that's all I want to talk about. And then if there's any other question, if you guys want to talk, or if you have some myths in your mind that why somebody should not do neurosurgery, we can dispel some of those myths. Yes. So it's true that, just like cardiac surgery and any other fields, the neurosurgery is also going towards, so about, I would say 20 years ago, everything was big open brain surgery, right? Everything was open, big. We only had CT scan by that time. MRI had just come into play, and we didn't have a lot of information. And as the time is progressing, the endoscope comes into play. So now you're making smaller incisions, you're using endoscopes to do things. The minimally invasive style came into play for spine surgeries, for brain surgeries. Then the endovascular came into play. So aneurysms and all these, vascular problems are not getting clipped, but they are actually going towards more non-invasive ways. And then LITT, this the what the Azam just spoke about, comes into play now. So even for epilepsy surgery, you do not have to do an open surgery, or even if it's an open surgery, it has to be a little minimal invasive. But remember, all these technologies cannot replace a human mind, right? My boss used to say that you can teach a monkey to become a neurosurgeon, okay? But what actually takes to become a neurosurgeon is when you understand when to do and when not to do neurosurgery, and to make the right choices, right? So that will always be there, although the technologies will change. Any other questions anybody has before we wrap up? Yeah? Okay. Yes, USMLE three scores, or just USMLE scores? USMLE scores matter a lot. Okay, so if you want to go to US, you have to make sure that you really score high, because as I said before, that your competition is the top 1 to 2% of the medical school class. Those are the people who really want to do neurosurgery in the US, right? And their scores will be really high. If your score is low, nobody is even going to look at your application. When you go through the application process, they put a cutoff on a score, okay? So if your score is lower than that, it is just thrown out anyway. Nobody goes through what other work you have done, how much research you have done, or how many community services you have done. Nobody's going to look at it. So the number one criteria is USMLE scores, okay, or USMLE scores. I do not know what is these days, because I mean I did my USMLE ages ago. So I think somebody recent would be able to know. Yeah. But it's usually the 90th percentile or higher or something like that.
Yeah, our typical USMLE are people in the 250s, 260s, and 270s. Those are the typical people that we're matching. The top 5%. Like I said, it's a criteria to get an interview with us that we look at. It's a very competitive field.